Hi, my name is Dale Smith. I'm Creative Director for Bridge. And firstly, I'd like to thank you for considering me to participate in the summits in both London and Athens. And as per your request, I'm putting together a short video that will outline a little bit more about myself, Bridge, what an audience would get from our participation at the event, and some key touch points that I'd be speaking about. So firstly, me, I'm Dale. I'm Canadian. I've lived in London for the last 25 years. And in most of that time, I've worked in some aspect of employee engagement, culture, customer experience, which leads nicely onto Bridge, because at Bridge, we are a people specialist. And as an agency, we focus on business transformation, employee engagement, and culture. But how these all come together is we focus on what is the brand promise and how that emanates out of any organization to the customer population. That customer population then creates an expectation of what that service will be like when they engage with the organization. And then ultimately looking at the culture or the community that supports that service. So at Bridge, what we look at is how does that brand promise and the engagement of its employees connect together so that they are simultaneous? Because in that simulation, we get great customer experience. So I'll be looking at lots of different industries, drawing on our experience from major banking groups that we've worked with, from hotel groups, hospitality industry, but primarily I'll be focusing on some key projects that we've done in the private healthcare sector. Working with some private hospitals on engaging their employees to deliver an amazing customer experience that matches the brand promise. And when we look at that brand promise in the private healthcare market, it actually sits in two different ways. One, private, and the other, hospital. So the hospital has a very emotive service that it gets attached to it. And patients, when they come in, have an already different level of expectation. Adding on the level of private to that offering changes that expectation even more. So what I'll be looking at is how do we find that intrinsic link within the organization so that we can deliver on those promises. We all know that the private healthcare sector is getting more competitive all the time. And in that competition, we have to deliver the service that really keeps the patients happy, but keeps them coming back and recommending us on a regular basis. So what the audience would get of a presentation that we put together will be key experiences, but actual real life experiences where we've worked in hospitals and linking the employee engagement and the culture of that organization to the experience and ultimately delivering that brand promise. So thank you, and I really look forward to meeting you.